Hi, good morning. I'm Denise PLANTE, and it's so nice to see that you're starting your week out with us. Well, the new year brings with it a renewed opportunities for fine-tuning your appearance, and the advancements in plastic surgery and 3D imaging make it easier than ever to achieve the natural-looking results that you desire. Now, the key is choosing the right practice that has earned a reputation for excellence, a name that you can trust. Dr. Paul Zwiebel has been recognized as one of the top docs from 5280 magazine 6 times over and is celebrating 25 years in the field of cosmetic surgery. He's joined by HARDESTY, patient coordinator, and one of his many satisfied patients, Karen ENOCH. Hi.
Morning.
Happy New Year. Well, first off, it's so nice to meet you. I've seen your articles in 5280 and all the honors that you received. Let's start with one of the many reasons why your patients come to see you for a breast enhancement.
Well, of course, one of the main reasons is that women may be small-breasted and want to enhance their figure. Another big reason is after pregnancy, women will have deflation of the breasts and they want to enhance their figure or restore what's been lost. Oftentimes, we also have patients who have natural asymmetries or deformities that we can correct with breast augmentation.
And let's just face it, after pregnancy, it doesn't matter how many weights you lift or what you do, sometimes they just don't pop back to normal, and you got to go see the good doctor. Tell me what happens in a consultation, an initial consultation with you.
The consultation is a great opportunity for the patients to get to know us and for us to get to know them. Very importantly, we want to spend time during about an hour that we spend with the patients to get to know what it is that they want to achieve so we can give them good advice. Of course, answer all their questions and really give them an opportunity to meet my entire team.
You know what's cool, Dr. Z, and I've never heard of this before. You use a new machine, 3D imaging, that kind of shows the patient what the results are going to be before it actually happens. Explain to me how this works. We're looking at a photo right now.
The device that we're using that you can see on the screen is called an Axis 3 three-dimensional imager. During the consultation, the patient will stand in front of this device. You can see it's got 6 camera heads. And the device will go ahead and take multiple pictures, which the computer then synthesizes into a 3-dimensional image of the patient's own body. The great thing about this is that the patient can actually see themselves in 3 dimensions. We can rotate it up and down, side to side, and then we use the software to try different size implants. So rather than wondering how somebody might look after surgery or looking at other before and after pictures, the patients have an opportunity to actually see themselves.
That's really cool because every body type, I mean, you're different and you don't know if big is too big. This helped you in your decision, Karen?
Oh, it was wonderful. I was able to see different sizes, different profiles, how it would look on my body. I was just very reassured knowing what it was going to look like afterwards. It's really a good idea.
I've never heard of it before. This is like one of the first procedures I ever heard of that you could actually see the results and make the adjustments before going in the surgery room.
We were very fortunate. Our practice was actually one of the first in the country that was able to get this technology for our patients, and it's made a dramatic difference in the consultation process. It makes an enormous difference in giving patients an opportunity to see themselves so they feel much more confident about their choice.
And it's the Axis 3?
That's correct.
Okay, so a lot of different benefits as we take a look at the picture right there showing the increase in size and what's right for you. Some of the other patient results, I know we have photos that we're going to take a look at. If you can walk us through, Dr. Z.
Be happy to. This young woman, 34 years old, came for breast augmentation just to enhance her figure. In this instance, we use silicone gel implants, and you can see that the contours are very nice and natural. She was very pleased with her results. These photos are at 9 months post-op.
Boy, that goes back to self-esteem. I mean, we were talking earlier about the reasons why women come to see you, and that is probably another huge factor that plays into it.
Probably the most important factor. People really feeling much better about themselves. This is another patient who's also about 7 months post-op who elected to have breast augmentation, here again with silicone implants. I think the next patient that we have an augmentation using saline implants. And the salt water or saline-filled implants can also produce a very nice, natural result. This next patient is actually a woman who developed deflation after pregnancy. And here we use breast augmentation to, again, restore some of that lost volume.
Big difference.
In this patient, who is in her late 30s, after pregnancy, she actually developed quite a bit of deflation and drooping. For her surgery, we combined doing the breast augmentation together with a breast lift. Sometimes we can accomplish the reinflation of the breast with implants alone, and other times we have to use lift surgery to help.
Makes sense. And Amy, working closely with Dr. Z, you have to see the difference in these women, not only just because of the surgery, the breast augmentation, but in their face, how it lights up with their self-esteem.
Absolutely, absolutely. It makes a world of difference. Look at Karen.
Yeah.
It makes a big difference, and it's very satisfying to see that.
Why do you think, Dr. Z, so many people choose you? There are a lot of options out there. Why are the patients coming to you?
That's a great question. I think one of the fortunate things for me is that I really have a great team who, like myself, care a great deal about the patients and create an environment of caring. And actually, if it's all right, I'm going to let Amy talk about that a bit, because she has an opportunity to talk with the patients from their very first phone call, following them all the way through the end of surgery.
Okay, so you
I
get the
do
sneak
answer
peek.
this question quite a bit, and most of our patients come referred through other physicians and our current patients that we have. Dr. Zwiebel comes highly recommended for his reputation and his excellent results. He has an excellent bedside manner. Patients constantly are telling me how comfortable they feel with him and how down to earth he is. He just answers their questions very thoroughly, and it really helps the patient make a decision about who they go to. Like he said before, our office, we have a wonderful team. The minute you walk in the door, you feel right at home with us. And again, it puts the patients at ease to be, so comforted when they come in. Another thing, in addition to the Access 3 that distinguishes us, is Dr. Zwiebel uses a pain pump. And it's a device that dramatically reduces, if not eliminates, the discomfort following breast augmentation.
Wow, so that's a huge plus in your office, the technology that you have, the Access 3 and the pain pump. Tell me more about how the pain pump works.
Well, the pain pump is a fantastic device. Of course, one of the barriers for surgery is the fear of not only how will things work out, and the Access 3 helps with that, but also how much post-op pain there'll be. We started using the pain pump about 5 years ago, and at this point we've used it in over 700 patients. It's an elegant little device where we insert tiny little tubes, just like small catheters, right into the area of the surgery, right around the implant. Post-operatively, there's a pump that slowly drips in anesthetic solution, the same thing that the dentist used to numb your teeth. So it's very safe, very comfortable. We actually did a study looking at the use and the effectiveness of the pain pump, and we found that our patients used less than half the pain medication that they would otherwise use if we weren't using the pain pump. And I wonder, Karen, why don't you tell a little bit about your experience?
I really was very impressed by the pain pump. Whenever I thought it was getting uncomfortable, I could just push and it would bathe the entire area, and instant relief.
Yes.
It's just amazing. It's
a fascinating experience. It
really
sounds like you
incredible.
really had a great time and happy with the results.
Very.
Doctor, before I close, I just want to say congratulations to you. 25 years in the business.
Thank you.
That's quite an accomplishment.
Thanks very much. It's great to be in a field where I can actually help people feel better about themselves.
Well, and on a more personal level, I want to talk about your missions that you do around the world to help others.
Actually, it was an aspiration of mine early on from when I went into training to address the great need for people around the world who really don't have access to health care. In the last few years, I've been able to travel to Africa, Kenya, Ethiopia, also South America, Peru. The need there is enormous, and after you experience the poverty and the need, when you come back to this country, you realize how fortunate we are, and it always leaves me with a sense that I've gotten much more than I could ever give.
Well, it was a pleasure meeting you.
Thank you.
You know, it's obvious this is more to you than just a job. You're paying it forward and helping others. Thanks for sharing your story. Thank you for coming on. All right, whether you're looking for an extreme makeover, maybe just a little touch-up, you're in excellent hands with Dr. Paul Zwiebel. And you can learn more about Zwiebel Center for Plastic Surgery online at drzwiebel.com.